Have you ever considered the potential risks that may be present in your everyday activities? Factors that could unexpectedly pose serious threats as we reach the age of 70. As we grow older, our bodies may become increasingly susceptible to specific health concerns that often lack clear indicators. Numerous individuals hold the view that sudden death is merely an unfortunate and unpredictable occurrence. However, the reality is that there are particular triggers that greatly elevate the risk of life-threatening emergencies. Regrettably, many of these factors are frequently overlooked until it is too late. In this video, we will reveal 5 sudden death triggers that can unexpectedly catch individuals off guard after the age of 70. These issues are not merely trivial health matters, they are insidious threats that can emerge unexpectedly. From undetected cardiovascular conditions to seemingly innocuous daily routines, each of these factors can lead to severe repercussions if not addressed. However, there is a silver lining. By understanding these risks, you can implement measures to safeguard your health and lower your chances of adverse outcomes. Remain with me throughout this discussion, as comprehending these 5 triggers could significantly impact whether you enjoy a fulfilling life in your later years or encounter preventable challenges. Medical emergency. By the end of our discussion, you will possess a comprehensive understanding of the potential concerns and, crucially, the measures you can take to protect yourself from these risks. Now, let us explore the first topic, silent heart attacks. One of the significant health risks after the age of 70 is a heart attack that can occur without any prior warning, contrasting sharply with the dramatic portrayals often depicted in films where an individual suddenly clutches their chest and falls to the ground. Silent heart attacks, often present without clear warning signs, quietly manifesting and frequently misinterpreted as indigestion, fatigue, or a mild illness. This subtlety can lead many individuals to forego seeking medical attention, allowing heart damage to progress unnoticed until it becomes critical. Consider a 74-year-old man named Richard who enjoys his morning walks and occasional rounds of golf. A few months ago, he experienced unusual fatigue, slight shortness of breath, and mild discomfort in his upper back. He attributed these feelings to poor sleep and dismissed them. Unbeknownst to Richard, he had just endured a silent heart attack. Lacking the typical crushing chest pain associated with heart attacks, he believed his condition was not serious. However, weeks later, significant damage to his heart had already occurred, placing him at a considerably higher risk of sudden cardiac arrest. Silent heart attacks happen when blood flow to the heart is obstructed, yet the symptoms may not be readily apparent. Instead of experiencing sharp pain, one might notice discomfort in the jaw, neck, or upper stomach. Additionally, feelings of slight dizziness, unusual fatigue, or nausea may occur. Some individuals may confuse it with heartburn, muscle strain, or even anxiety. However, the truth is that even in the absence of intense pain, your heart remains affected. Being deprived of oxygen can lead to cumulative damage over time. The real risk arises when a subsequent, more severe heart attack occurs. If your heart has already been compromised by a prior silent attack, your likelihood of surviving another diminishes significantly. Many individuals only learn they have experienced a heart attack during a routine checkup or, tragically, after an unexpected collapse. This underscores the importance of awareness. If you encounter unexplained fatigue, shortness of breath, or unusual discomfort in your upper body, do not ignore these symptoms. Seek medical evaluation. A simple electrocardiogram, EKG, or blood test can determine if your heart has been affected. Preventing silent damage is crucial. Identifying warning signs, even when they appear non-urgent, can significantly impact outcomes. Number 2. Orthostatic hypotension and incidence of falling. A sudden decrease in blood pressure upon standing may seem trivial, but for individuals over 70, it can pose serious risks. This condition, referred to as postural hypotension, can lead to symptoms such as dizziness, lightheadedness, and even fainting, particularly in younger individuals. A brief dizzy spell may seem like a minor inconvenience, yet for older adults, it poses a significant risk for serious falls incidents that may lead to severe cranial trauma or fractures of the hip. The concerning aspect of this situation is that many individuals fail to acknowledge it as a significant problem until they have already experienced its consequences. Consider an individual such as George, a 78-year-old who relishes his morning coffee at the local diner. One afternoon, he stood up too quickly from his chair and suddenly experienced a spinning sensation in the room. He reached out to steady himself, but before he realized it, he lost his balance and fell to the floor. The fall resulted in a fractured hip, and although he anticipated a straightforward recovery, complications arose. He spent weeks in the hospital fighting infections, and what began as a simple dizzy spell evolved into a life-threatening situation. Falls represent a significant health concern for older adults, not solely due to the immediate injuries they cause, but also because they can trigger a decline in overall health. A hip fracture, for instance, may result in prolonged immobility, which can weaken the body, elevate the risk of blood clots, and increase susceptibility to infections. Many older individuals who experience a serious fall may never fully regain their independence. Even if they survive the initial injury, the subsequent complications can be severe. This raises the question of why postural hypertension occurs more frequently in older age. As we age, our bodies take longer to adjust blood pressure when transitioning from sitting or lying down to standing, and the heart may struggle to pump blood effectively. Dehydration medications or underlying health conditions can exacerbate the situation, which is why some seniors may feel stable while seated but experience difficulties upon standing. The most concerning aspect is that this can occur unexpectedly, and once a fall happens, it may trigger a series of health complications that are challenging to overcome. If you have ever experienced dizziness when standing up, it is crucial not to disregard it. Making straightforward lifestyle changes such as rising gradually, maintaining proper hydration, and reviewing medications that could lead to low blood pressure can help mitigate your risk. However, the most crucial aspect is being aware of your condition. Identifying the early indicators and implementing preventive measures can significantly reduce the risk of a fall that may alter your life dramatically in a moment. If you are still engaged with this video and appreciating the insights provided, kindly comment with the number 2 below to indicate your presence. Additionally, if you have not yet subscribed, I encourage you to do so and activate the notification bell to ensure you do not miss any future videos. Your support is instrumental in allowing us to continue producing valuable content aimed at informing and inspiring you. Let's proceed with the next steps. 3. Concealed blood clots. Deep vein thrombosis. Numerous individuals perceive blood clots as events that occur solely in severe circumstances, such as post-surgery or following an extended hospital stay. However, what many fail to understand is that blood clots can develop silently in the legs, frequently without any noticeable symptoms. When these clots dislodge, they have the potential to migrate to the lungs, resulting in a sudden and potentially lethal pulmonary embolism. This underscores the importance of recognizing deep vein thrombosis. DVT is often referred to as a silent threat, as it can develop gradually yet can manifest suddenly and severely. Consider a gentleman named Harold, a 76-year-old who relishes spending hours reading on his porch. He doesn't view himself as sedentary. He still runs errands, takes brief walks, and engages in light gardening. However, one day, after an afternoon spent in his recliner watching television, he noticed some mild swelling in his calf. It wasn't painful, just slightly puffy, and he attributed it to sitting in one position for too long, choosing to disregard it. Days later, he experienced shortness of breath but assumed he was merely coming down with a cold. What Harold was unaware of was that the swelling in his leg was due to a clot, and when he unexpectedly collapsed one evening, it was because that clot had migrated to his lungs. He never anticipated such an event. The concerning aspect of deep vein thrombosis is that it can arise in individuals who do not perceive themselves as inactive. Extended periods of sitting, whether while watching television, driving, or even during sleep, can impede circulation in the legs, facilitating clot formation. The symptoms are often subtle and easily overlooked: mild swelling, slight tenderness, or a gentle cramp in the calf. None of these signs appear urgent, yet if a clot dislodges and travels to the lungs, it can obstruct oxygen flow within seconds, leading to sudden collapse or even immediate death. Older individuals face heightened risks as circulation tends to diminish with advancing age. Additionally, conditions such as diabetes, heart disease, and hypertension exacerbate these issues. Certain medications, particularly those frequently prescribed for managing blood pressure or cholesterol, may also have an impact. Clotting and dehydration, prevalent in older adults, can thicken the blood, increasing the likelihood of clots. This combination transforms what may appear to be a minor concern into a serious risk. The most effective way to prevent DVT is to maintain movement. Prolonged sitting can exacerbate the situation. It is advisable to stand up and stretch every hour. Flex your feet, move your legs, and ensure you drink plenty of water to promote healthy blood circulation. Consider using compression socks, and if you observe any persistent swelling, redness, or warmth in your leg, it is important to seek attention promptly. Seek medical attention without delay. Identifying a clot at an early stage can significantly impact the transition from standard care to a critical situation. Now let us discuss another subtle yet significant risk that many individuals overlook. Neglecting the fourth number can result in unnoticed infections that may lead to sepsis. One of the most insidious threats to individuals over 70 isn't something as overt as a heart attack or stroke. Rather, it is something much more subtle. An infection that appears trivial can gradually progress into a severe and life-threatening condition known as sepsis. Sepsis represents the body's severe response to infection, resulting in widespread inflammation that can culminate in organ failure, shock, and even sudden death. Its peril lies in the fact that initial symptoms often appear mild, leading many, particularly older adults, to overlook them until it becomes critical. Consider Walter, an 81-year-old who takes pride in his infrequent visits to a healthcare professional. One afternoon, he observes an increase in urination accompanied by a slight burning sensation. He attributes it to the aging process and increases his water intake, believing it will resolve. However, over the following days, he experiences fatigue, confusion, and an unusual chill despite the warm weather. By the time his family persuades him to seek medical attention, the infection has already infiltrated his bloodstream. Within hours, his condition deteriorates, and despite the medical team's diligent efforts, Walter's organs begin to fail. Many individuals remain unaware that common infections, such as urinary tract infections, can escalate to such critical levels. Urinary tract infections, pneumonia, or even minor skin wounds can quickly progress to sepsis, particularly in older adults. As individuals age, their immune systems weaken, making it increasingly difficult for the body to combat infections effectively. What begins as a straightforward urinary tract infection or respiratory issue can escalate into a severe systemic emergency if bacteria infiltrate the bloodstream. Once sepsis occurs, every moment counts. Each hour without appropriate treatment heightens the risk of mortality. Recognizing the early signs of sepsis can be challenging, as they often resemble common ailments such as fatigue, mild fever, confusion, or weakness. Many older adults may dismiss these symptoms as mere discomfort, unaware that these subtle indicators could signify a serious infection requiring immediate attention. If not addressed promptly, sepsis can lead to dangerously low blood pressure and the failure of essential organs, including the kidneys, liver, and heart. In certain instances, the condition can escalate so quickly that individuals may not reach the hospital in time for treatment. It is crucial to be vigilant and proactive in seeking medical advice when these symptoms arise. The importance of addressing infections cannot be overstated, regardless of their perceived severity. Should you experience symptoms such as fever, chills, sudden confusion, or an unusual sense of weakness, it is crucial not to dismiss these signs. If a minor infection fails to show improvement with home care, it warrants further attention. If you or someone you care about shows signs of sepsis, including rapid breathing, severe fatigue, or a sudden decrease in blood pressure, it is crucial to seek immediate medical assistance. If you are still engaged with this video and appreciate the information provided, please comment with the number 4 below to indicate your presence. Additionally, if you haven't subscribed yet, I encourage you to do so and activate the notification bell to stay updated on future content. Your support is vital in helping us produce valuable information for you. Now, let's proceed. Medication number 5. Ineffective administration. One of the most overlooked risks after the age of 70 is not a disease or an accident. Rather, it is an occurrence that takes place in households daily. Medication. Ineffective administration. Administering an incorrect dosage, omitting a dose, or mixing incompatible medications can result in severe reactions, potentially culminating in sudden cardiac incidents. Strokes or potentially life-threatening internal bleeding. The concerning aspect is that numerous seniors remain unaware of their vulnerability until after an error has occurred. Take, for instance, an 82-year-old woman named Helen who has been managing her blood pressure with medication for years. She diligently takes her pills each morning. However, one evening, after experiencing back pain, she takes an over-the-counter pain reliever without a second thought. The following morning, she feels lightheaded and weak, attributing it to hunger. Later that day, she collapses. Unbeknownst to her, the pain reliever she ingested had a perilous interaction with her blood thinner, leading to internal bleeding that remained undetected until it was too late. As we age, our bodies metabolize medications differently. The liver and kidneys become less efficient, resulting in drugs lingering in the system longer and occasionally accumulating to toxic levels. Medications that may appear benign during youth can exert more potent effects as one ages. Additionally, the combination of incompatible substances, including over-the-counter medications or herbal supplements, can lead to serious, potentially life-threatening outcomes. Anticoagulants, heart medications, and pain relievers are among the most frequently encountered challenges. Even a seemingly minor event, such as missing a dose of heart or diabetes medication, can lead to significant physiological distress. Additionally, prescription overload presents another critical concern. Many seniors manage various medications for different health conditions, and the process can become quite complex. Certain pills must be taken on an empty stomach, while others are best taken with food. Some medications should not be combined, and others necessitate exact timing. A minor scheduling error can lead to significant issues. Doubling a dose due to uncertainty about whether you have already taken it can lead to a sudden drop in blood pressure, dangerously low blood sugar, or a fatal heart rhythm. To protect yourself, always maintain an updated list of all your medications, including supplements. It is essential to ensure that each healthcare provider you consult is fully informed about all medications and treatments you are currently using to prevent any potential harmful interactions. Utilize a pill organizer or establish reminders to ensure you consistently adhere to your dosing schedule and avoid the risk of overdosing. Additionally, it is essential to consult with a healthcare professional before initiating any new medication, whether it be prescription or over-the-counter. Consult with your healthcare provider or pharmacist to determine if it's safe to take with your current medications. Your well-being is far too significant to be left to uncertainty. Even one small mistake with medication can have devastating consequences, so staying informed and organized can mean the difference between life and death. Now let's move forward. Final thoughts. Carnarvon. Having examined these 5 sudden death triggers after the age of 70, it is important to take a moment to consider which of these risks may be relevant to you or a loved one. It is important to recognize that many individuals may not fully understand the delicate nature of various health aspects as they age. Often, the most significant risks are those that remain undetected until they reach a critical point. However, the encouraging aspect is that being informed is the initial step towards safeguarding one's health. It's possible you've noticed occasional dizziness upon standing but dismissed it, or perhaps you've overlooked mild swelling in your leg, attributing it to prolonged sitting. These signs can be easily missed, yet minor adjustments in your daily routine, such as rising slowly, maintaining hydration, and ensuring regular movement, can significantly impact your well-being. Additionally, if you are taking medication, verifying dosages and potential interactions can be one of the most effective measures to safeguard your health. The intention of this message is not to induce fear, but to equip you with essential knowledge. The more aware you are of these risks, the greater control you can exert over your health. Recognizing the subtle indicators of a silent heart attack is a crucial step in this process. Monitoring for initial signs of sepsis or averting hazardous situations. Falls can significantly impact your longevity, and it's essential to recognize that being proactive about your health involves more than just steering clear of risks. It's about ensuring that you can keep enjoying life, cherishing moments with loved ones, and engaging in activities that bring you joy. We appreciate your participation today and encourage you to share your insights in the comments below. Let us know one thing you learned today and how you intend to incorporate it into your life. Your feedback is valuable, so please feel free to express your thoughts. Your feedback provides us with significant motivation and encouragement. If you found this video enjoyable and helpful, please consider liking, subscribing, and sharing. Your support is essential for us to continue producing quality content that informs and inspires. Thank you for watching, and we look forward to your presence in the next video.